Thank you all for joining us at our first Prevention Science Working Group meeting of the year. So the group was established last year to bring together faculty, postdocs, students and staff with interests in this broad area. So we aim to enhance collaboration and put the word out about shared resources around campus to the end that these efforts will help us to be agile and moving forward for larger grant opportunities when appropriate ones come to be available to us, including program project grants, center grants, training grants. So we began just last semester, last spring. We started with a research seminar. My departmental colleague, Matthew Goodwin, who's jointly appointed in Corey. And then we moved on to a two-part didactic session on E&M health with Varun Mishra, also jointly appointed between Corey and my department, and Amy Liu, who is jointly appointed between communications and CAMD in our department. So very trying to be optimally collaborative here. And then in in April, we finished with a town hall on scaling for real-world intensive longitudinal research studies with Stephen and Tilly, also jointly appointed between Corey and my Department of Public Health and Health Sciences, Matthew Goodwin, and Varun Mishra. So what we're trying to do in terms of the programming is combine the standard research seminars like we're going to do today with some alternate programming, and specifically the type of alternate programming you would expect out of a training grant. So that's why things like panels, didactic sessions, which are basically like how-to classes, that type of thing. So we have some exciting programming coming up this semester. So we don't have a confirmation, a final confirmation, so I don't want to share the name. But in early October, we're looking at back-to-back sessions with an external speaker who will be joining us from the West Coast, I'll say. So we're planning on, and these details will be out soon, but we're planning on a didactic session day one on affiliating and partnering with the community, with members of the community, but doing so in other countries and other cultures. So, and then a research seminar following the next day. And we'll be taking a similar approach in November. We'll be joined by Dr. Lynn Filene from Dartmouth. She'll be with us on the 12th and 13th of November. So on the 12th, she'll be involved in a panel on, again, affiliating with the community, although the focus there will likely be in urban areas in the United States. So we're still looking for panelists there. If that's something of interest, if you feel you have expertise from your area to contribute to a session on partnering with members of the community, please let us know. And then the following day on the 13th, Lynn will do a research seminar. So I have a couple of different ideas about December, either possibly a second part of this didactic session on working with members of the community and other cultures, or maybe an informal session where we talk about shared resources and how we can utilize those. And speaking of that, we have a spreadsheet that we started last semester to track and catalog the shared resources we have across our different departments and colleges that we'll circulate again for folks to update and add to. And so that would be another idea in December, is just to discuss how we can share each other's stuff, right, and do more stuff with it to avoid being overly technical. So today we have our colleague Dr. Elena Villar with us. We're pleased that she's willing to kick us off with a great research seminar for our academic year. So Dr. Villar joined us in Northeastern in 2022 from Florida International University, where we have some shared friends there. She serves as the chair of the Department of Communication Studies with an affiliate appointment in our department, the newly renamed Department of Public Health and Health Sciences. She's also a faculty affiliate with the Latinx Student Cultural Center and a founding member of Public Engagement with Science Hub in CAMD, who are also partnering and joining with us today. So again, collaborative here. Dr. Villar's research is situated at the intersection of strategic communication and health science communication, focusing on community engagement with underrepresented and hyper-vulnerable populations. Many of her projects involve co-creation of content with community members around topics such as mental health stigma, domestic and sexual violence, vaccine hesitancy, and environmental threats to communities. So co-created products include fotonovelas, radio stories, community theater, and board games. I love these different ideas and approaches. It's fantastic. She's published over 50 peer-reviewed journal articles, book chapters, and articles on conference proceedings, and has been PI or co-PI on several multidisciplinary sponsored research projects. And I mentioned her previous institution, Florida International University. She was chair and associate dean there and led efforts in addressing barriers to equity, diversity, and belonging in academia. So really looking forward to this talk on strategies to engage communities in co-creation of prevention communication. And without any further,
Great, thank you, thank you. Thank you for having me, and I'm excited to kick off the theme of engaging communities for prevention and prevention science. And specifically, as you know, I have a background in both public health and communication. So yeah, so I look forward to letting you know. So overview, what am I gonna cover in this amount of time? Generally, some concepts and terminology. My examples of projects that I've worked on and one that I'm working on currently, and some reflections and considerations for doing this kind of work of co-creation for it to be genuine. So yeah, some of the common concepts that are important for this. So the first is, what do we mean with engagement, right? And participatory. And I also identify as somebody that does participatory research, community-based research. So one key thing there is that community members are equal partners. It's really important for this to work, that the academics and bureaucrats that are working on this truly acknowledge the community as being experts, right? And that their contribution is just as important, if not more, because then it's not truly participatory. Another aspect is that it combines knowledge with action. So it's not about imparting knowledge or just gaining knowledge. It's from the other experts. It's taking that and then doing something. So there's something, there's a problem-solving aspect to participatory methods. And another important piece that's administrative but also politically and very, very important is that resource sharing is real, and that and that means and includes, and very importantly includes, the budget, right? That that community members know what the budget is, know where the money's going, and have a fair share, and that they feel it's a fair share. So the different projects that I'm going to talk about today generally follow these three phases that's adapted from a model by the CDC from the 1990s, but it includes first participatory research, where you engage community members to do the research together with the quote unquote experts or topic experts or academics. And then there's story development. All the examples I'm going to talk about today have to do with writing a story that people can relate to, and then producing the stories and some evaluation. This was adapted from a model developed by the CDC in the 1990s for HIV prevention called Community Promise, where there was community engagement and mobilization, but it ended with small media materials, right? So this is the example here of fotonovelas, right? And of course now with digital technologies, this can take many forms, right? But it starts with mobilization, but I specifically wanted to look at the kind of circles in the middle. So first, community identification process is what they call this participatory research. What's in the community? What does this problem look like? What do people think about it? What are the stigmas attached to it? Things like that. And what are the stories? So it's about hearing stories of what it meant, how it manifests, right? What it looks like, the kinds of decisions that people have to make, and then writing the stories. And then community folks then disseminating the story as peer advocates or something like that. And then evaluation, because in public health, we know it's important to not just do things, but show that they work, that they worked, or that they're making some sort of impact. And, from the communication perspective, these stories are based on behavioral theories, on social learning, and that people learn from observing others, on, how much people interpret their own risk and the benefit of doing certain things. So those health behavior and models are important here too, but I'm not going to go into that too much. So when I talk about co-creation, it's related to participatory, but it's active engagement from all the participants. So, you'll hear this in business, right? Co-creating a product or service, where the folks that are going to end up using it are part of the development and the design on it. So it's a design process. So again, it involves sharing power, acknowledging that the end users of something are just as important as the experts designing it, and where the consumers play a central role. What do I mean when I talk about prevention communication? So for those that maybe are not from public health, the public health model involves first epidemiologic surveillance, identifying risk factors, and then identifying what needs to change to reduce or mitigate those risk factors, right? So when we talk about prevention, it's about the risk factors and what can people do that. So of course, a lot of prevention also, not to minimize, is structural and has to do with funding and laws and things like that, right? But at the kind of social communication level, it's how do we communicate what people need to know to reduce or mitigate their risk, right? So it means producing messages. They can be verbal, they can be visual, to empower people, to give people what they need to make decisions and healthier choices, right? Given their context. And an important kind of communication concept in prevention communication is behavior change communication, because something that we know is that just putting up posters that say "just say no" or posters that say "wear a condom" is not enough to make people change behavior, right? So there's a lot behind understanding why people make the choices that they make, what their beliefs are, and things like that, and what would motivate behavior change. And generally, prevention and doing prevention communication in a way that's accessible is a public health imperative. It's part of Healthy People 2030. And, the idea is to do health communication in a way that people understand it and know how to act on it, right? Because it's not enough to know the new vaccines are mRNA and it's a new technology. What does that mean for me, and how do I use that information to make decisions? So, like I mentioned before, the public health model has a focus on prevention, and the idea that diseases, and in some of the cases I'm going to discuss, violence, are not inevitable, and that there are things that can be done to prevent it. So one is to believe that, and then the other is to present the topic in a way that's relevant to people, and find the right medium to communicate it to your audience. And for some, that might be low tech, and for others, it might be using digital technologies. So those are all things to think about in terms of prevention communication. What we do know that works based on research is that it's not enough to be technical and to educate, deficit-based communication about this is what you don't know, let me tell you what you need to know, but making it tangible, making it possible to translate that into taking action, and that involves many times having someone to connect to, right? So the spokesperson has to be the right person, the scenario has to be correct, that people grab attention and can relate to, and I'll talk more about that. And then, again, there's been many initiatives for health literacy and making sure that things are communicated in a way that makes sense to people and that people understand, that's culturally relatable, right? So language that's easy to understand and meaningful. So all of the cases that I'm going to talk about today would be considered entertainment education. This is also a very, very deep topic and field, right? So a very, very short version is that it's media designed to educate through entertainment. So an example would be when you insert a storyline in a soap opera about a health issue, right? And but also can be content intended to teach, but has incidental entertainment value, right? So we teach children about colors and counting and shapes and things like that by playing, right? So it's that idea. So what makes it work? You create scenarios where people are placed in dilemmas and have to make decisions, and it stimulates the people watching or the people playing have to elaborate. What would I do, right? Put yourself in that situation. Thinking about the opportunities to think about the social norms or the beliefs that make you think the way you do. And then in a game, for example, provide alternate ways, or in a story, maybe going back to a soap opera example, where one character has one outcome for making one decision, another character has a different outcome for making another decision, right? So that the folks that are engaged in, consuming it and playing it or watching it are thinking about what they would do. So what makes this possible? These are three very important things from games and storytelling. People will relate to a story where there's perceived similarity between themselves and the characters in it. That doesn't mean they have to be exactly like you, but you have to relate. If it's completely unrelated to what you look like, an example in Miami when people would try to use materials that showed people in the snow, things like that, that just immediately kind of puts it one step away, right? So there has to be perceived similarity, and there has to be something about those characters and those situations, the scenarios, that I can identify with, right? And then the game or the story needs to be engaging enough that transportation happens, where you kind of suspend disbelief a little bit and get into it, right? If it's this boring process, then it's not really going to work, and you're not going to put yourself in the position of the characters. Which brings us to serious games, which is a kind of education entertainment. But the concept that I want to share, and kind of this is the research behind my examples with games, is that you place the players in situations where they have to make decisions, right? So you create scenarios based on your community research of what this problem looks like, what kind of challenges people encounter, and how they, and how the character might make decisions. And so the player can make decisions in a risk-free environment, right? Where they can discuss and talk about, in the more sophisticated the game, there can be consequences like losing points or, things like that. But it's like in a video game. If you die in a video game, it's okay, right? You can start again. So it's that concept, right? So I'll give you some examples of that. So it's, it's embodying the understanding of the problem and the decisions and the challenges that need to be made. So this is true for games and for other story-based formats. So now I'm going to go on to share some examples of work, of projects that I've worked on. So the first, I'm going to give 5 examples. The first one is fotonovelas for MUJER. MUJER is an excellent nonprofit in South Florida that provides domestic and sexual violence services. It started as a service for immigrants. Obviously, it serves everybody. But it was a CDC-funded project and under culturally specific services, right? So under the outreach of it. So there was already, the county had flyers and brochures of the services that are available. There was, so it's not like there was no information in Spanish available. What it was is that people weren't really using it, or because they kind of didn't understand it and weren't sure if it was for them. And there's many, many barriers which is also would be a different talk about why immigrants might choose not to use services even if they need them and all of that. So yeah, so we engaged. This is where we first tried to practice the community promise model, engage community leaders, had a group, talked about community-based research, talked about the process. They went out, talked to people they knew, their neighbors, their family members. What does this look like? What is domestic violence and sexual violence? There were going to be 2 topics. We kind of brainstormed general things. And, in our mind, what we were we had as the public health people, the folks that wrote the grant, some ideas of what the topics were going to be, but the community came up with other topics, right? So we did have, like date rape and what it looks like, and, the example showing that it's not it's people, even with people you trust, that can happen. We had a child sexual abuse case with things like that. But an example of like stalking and trying to control someone on the phone, people felt really strongly that that was one of the ways that power and control manifested, right? And that the examples include, I'm going to take the kids back to Honduras, and I'm going to, move states and not let you see them if you don't call me right now, and things like that. Marital rape, which of course is rape and it's illegal, but in many places it's not really recognized as such. So just raising awareness of what that looks like, and that generated a really interesting discussion, because the folks in the community wanted a happy ending, wanted counseling, and the guy learned, right? And so there were discussions even with the funder about what was appropriate, but it was really great because it was true co-creation. And then an interesting one was about, social criticism is what we ended up calling it, but it's kind of like the gossip and the shame and the social norms that are like, oh, she can't even keep her man, and, and why, that it's too embarrassing to talk about, and things like that, and how that is a deterrent. So, before the co-creation, there was a lot of listening, right? So there was going around, there was showing people, there was getting feedback, there was like, how does this story sound? Does this sound realistic? And the stories were a synthesis of the different stories collected in the community identification process. So, and then we had community members that acted, right? These are volunteers, where which was important. They insisted, and it's important, that said the people in the story are actors, and this is for educational purposes, because if their neighbors were going to see it, they didn't want to be associated with it. But yeah, there's conversations and dialogue that is coming from the examples from the community. So then, because after we learned that experience, there was a separate project, a new project called, for FACES, which was a program for children and adolescents, mental health services. And the communication challenge was that a lot of the immigrant families that had the most stress, that had perhaps the most need, also had the most stigma and less likelihood to use the services that were available to them, right? So similar thing, organizations, volunteers, community members, and came up with two topics. One is addiction, one is mental illness. They both had an older adolescent and a younger child. And again, it's kind of a composite of the different stories that came up from the community listening. And so before listening and co-creation, because if you just get the people that work in the nonprofit, that's not really the community, right? So you have to tell people that we're doing this, that we want you to get involved, that, hey, would you be interested in coming to this group? And, sometimes people understand focus group, right? We want to get away from focus group, but sometimes people understand they're being invited to a focus group, and they're like, thank you so much for giving us this opportunity to discuss. And we're saying, no, thank you, because you're providing data, right? But yeah, when I go into the reflections, I'll talk about, how important this part is. But yeah, again, this resulted in stories that had certain, emblematic situations or characters. So, that you call your friend to get advice, that, the husband and the wife don't necessarily agree. In this case, you call the police officer for the person having an episode and they get tasered, right? So these are all stories that came from the community listening. And, then it becomes educational too, by having the opportunity to reflect. What would you have done in that case? Here are some rhetorical questions, right? What would you have done in that case? Do you think this will affect my immigration situation? Because we know that that's something people care about, right? Should I, what do you think I should do about giving my elementary school child medication, right? So these we know from the discussions that it's what people are talking about. Do you think I can be cured? That character had bipolar disorder, right? So some people are like, wait, expect, we'll give them a pill and they'll get cured. So again, not only the content, but the questions came from the discussions. Part of that same project was with Haitian immigrants. And this is really interesting and a big learning about the arrogance of when you think people think they know. But we decided radio stories because the common knowledge was that Haitian Creole was not a written language. Is not, it can be written, but it's not how people learn it. And that the best way to reach the Haitian population is on radio, and there's Haitian radio stations and things like that. So a similar process where community members came in and developed some scripts, asked them to talk to folks, and came up with stories about depression, bipolar disorder, and substance abuse. And so the scripts were written in Haitian Creole based on the community discussion. So again, some of the sayings are, people would laugh when they hear it because it's very cultural, right? And it reminds them of home, and they find it funny that there's a public health message using their slang and things like that. Here we had family members that volunteered to record the voices. So we had to get the recording booth at the university, the logistics, right? That's something else I'm going to talk about, the reflections and the potential promise / threat of AI. But, and then, so here's the lesson that we learned. So we're like, hello, here, we paid for some spots to play the story on the radio. We had some interviews, and they were like, well, we want a booklet like the other one. Why does Spanish get a booklet to take home and we don't? Right? So that was fascinating to us. We learned, we worked with an illustrator that kind of came up with panels. And then this was a whole other experience in co-creation because, he first drew, Suzanne is the main character. He first drew her with braids, and they were like, no, Haitians don't do braids, like that, right? And but there were, this was illustrating the part of the story where it's like that many of us can relate to. What do you have to be depressed about? You don't have to pay bills, You have shoes. Your whole family didn't die in an earthquake. What could you possibly be depressed about? So that illustrates that. The grandma that has the natural healing, right, and things like that many people can relate to. The speaking to the priest. There's obviously more panels of speaking to the teacher, speaking to the therapist. What do those people look like in the minds of folks? So true co-creation, right? That it wasn't just like the illustrator drew it and then we sent it out. Third example, this is a board game developed with the Colombian National Police. Interesting, but the reason is they really, really wanted to do something to raise awareness and empathy for victims of commercial sexual exploitation of children and adolescents. So sex trafficking, right, of children and adolescents happens a lot in tourism industry, happens a lot in just where there's crime. And this happens everywhere, by the way, very important to say. This happens in the United States a lot, in every place where there's a lot of tourism. But the police were very aware of it and really wanted to raise awareness because it wasn't being reported for many good reasons. And so again, this started with formative research. This project perhaps had the most formative research and participatory research than any other because it was somebody's, my colleague Jessica Wendorf Mohammed's dissertation project. So there really was talking to many, many organizations and hours and hours and hours of listening of what this looked like, what people perceived about child sexual exploitation, commercial sexual exploitation. And some of the things that we learned was that there's why report it? There's lack of faith that the police can really do anything. Why get yourself in trouble? There's big crime rings involved. I'm not going to get involved with criminals. And some victim blaming too, right? Because people think that sex trafficking means people are like chained and forced, but many times they are coerced with iPhones and nice clothes and things like that, right? So, so a lot of great insight of what this looked like, how people understood it, and what was keeping folks from reacting. So then this was truly, we worked with a game designer, and that's where I kind of first truly understood what makes a game. It has to have a system, a beginning and end, you know. And so, yeah, started pilot testing it, putting folks in a scenario where they had to make decisions. So this was truly participatory. I talked to kids about what this would look like, what they imagined, things from, you know, through a WhatsApp chat. Should we keep the church? And they're saying, oh, they're saying the fountain is too big. So just as an example, right, that the folks are really felt engaged in what happened there. This is the final game design where you throw a die, move your piece. Depending on where you stop, you pick up cards where there are scenarios and you discuss. Report, report to whom, not do anything, report to whom, and then there's discussions of what could happen and things like that. And there's different themes. The lesson learned here, way too complicated. Amazing, awesome. It really put in a lot of the elements of social class, of access, of, hesitation of working with the police, but the game takes forever and people, so, learn, live and learn. So then we've kind of culminated in a model that, because again, from all that experience, we now felt more confident. So this was a project funded by one of the sexual violence, federal sexual violence programs that I should know, but I'm not remembering right now. But again, the idea, culturally specific, right? So it was a culturally specific prevention, outreach, and getting folks involved. So the idea here was youth. So this was it was designed for youth, children and youth, and looking at a bystander perspective, right? So what would you do? And the choices with the upside down exclamation point was, by the youth. And so, yeah, again, this was really interesting. We recruited youth leaders with the help of organizations and had some actual training on how to interview people in the community to collect these stories, including the ethical confidentiality, please don't give anyone advice type of factors when discussing these topics, right? Triggering trauma, different things. So this is really, really interesting. Lots of great discussions about what's appropriate, not appropriate to talk about this. And then youth went out and talked to their friends, their moms, their teachers, their older cousins, whatever, right? What does this look like? And it was interesting. They came back with some really great stories that, older folks like me that have come from a different perspective, even though I speak the same language, that's not what it looked like when I was their age, right? So, with this, we developed scenarios. So the idea is that you roll the dice. We ended up having to play it virtually because of COVID. So that's another interesting thing. But this is a good image of what it is. So, you move your piece, then there's a spinner that gives you a topic, and then you pick either social media, family, friends, or community. And the scenarios were very realistic. They were like, so, you go to buy soda at the store, and there's men drinking on the corner, there's a 12-year-old girl, and they're harassing her. What's your role? What do you do, right? And then there's options or something else, right? You see you're at the park and you see a girl walking with 4 guys to, then what do you do? And then there's discussions about are you keeping your own safety? How do you know they're not just out there going to have a drink or smoke weed and they're not your problem or something like that, right? So yeah, and then some cases in the family and what that looks like. So the winners of the way you get points here is by making a good deliberating and making a good case for your decision, and the rest of the group gives you full points or half points. So again, it's entertainment education. It's education with presented in a way that is engaging. But what did we learn from our previous experience? The length matters, right? That the scenarios are relatable matters. But this turned out to be a pretty good format that can really be used for any topic, because you can just change the cards. So yeah. So another great example of co-creation. Finally, the one that I'm working on right now is Renter's Story for Hurricane Preparedness. So it's actually funded by, it's a piece, again, the community outreach piece of an assessment by HUD about how farm workers who rent, usually trailers in Immokalee, Florida, and how did they fare in the last hurricane and how prepared are they for the next one? So again, this was led mostly by my colleague in University of Central Florida, Maritza Concha, but recruiting advisory group members. So again, it's working with the nonprofits, but you don't want the staff of the nonprofits, you want the recipients, right, of the services. And this was truly, truly participatory research where that group helped come up with the questions and the methods and how long should the survey be and what's the best way to collect the data. And then there were some focus groups, and they were part of the focus groups. And then they had Zoom meetings to discuss the focus groups and to analyze the data. And then what they decided was that they wanted to come up with stories that show kind of what can happen in a hurricane so that people can think about the ways they have to prepare. So here's kind of the novel, interesting thing that we're in the middle of doing right now. So they went through the transcripts and identified specific quotes, right? So the news say that a hurricane is coming. I'm afraid, I'm worried about my family and my kids, especially the baby. We were out of power for a really long time. That was really frustrating. The community helped us a lot. Our neighbors gave us food and water, but we also tried to help the people that needed it the most. My husband lost his job in agriculture, so he was looking for a job in anything else and things like that, right? So those are direct quotes, edited, slightly edited quotes from the conversations. And then it was fed into an AI program that came up with an image. Some of them are weird. Some of the hands have 6 or 7, but this is kind of new, right? Especially considering the fotonovelas and comics that I shared with you before. That part of generating the image is expensive and complicated. To take the photos, you have to think of how many outfits they need. We once got kicked out of a school because we didn't have official permission to take pictures in the school and things like that. So this is fascinating to me. But anyway, so what the group did in terms of co-creation and analysis was, okay, so here's emblematic or kind of representative scenarios from before the hurricane, after the hurricane, immediate recovery, medium and long-term recovery. And there were several of them, right? So then that's kind of where I came in for the storytelling assistance, right? And explained that, in order to tell a story, it has to have characters that you can relate to. They have to encounter a challenge. They have to think about ways that it can be solved. And then there has to be an outcome that could be really positive or not that positive, but helps you learn, etc. So yeah, we had Zoom meetings to discuss these and how would we put them into a story that, again, a composite story that represents the different aspects. And I'm very proud to say that they said this was the most fun of the Zoom sessions that they had. This was more fun than analyzing data. But yes. But yeah, work with the community advisory group to write the story. So basically, this is what we started with. This scrolls down further. But then in that conversation, obviously with the help of folks that feel that are quick on these things, moving the scenarios to create a story. So this is like story number 1, more text on what the story would be, the description. There was conversation of what would this person look like, because now we're feeding it into AI, right? So now, what does this person look like? How old is the mom? How old is the kid? What do they have? What's their hair like? What's in the house? So we'll see. So that's kind of where we are right now. There's programs to make comics with AI. We'll see how good they are, right? Again, show it to people, get feedback from the community, and then we'll see what the best format is for production, but whether it's a booklet, maybe even a poster, maybe something digital that can be shared on WhatsApp, right? But we'll see what it is. But so lots of ethical and, interesting questions about AI. So I'm not saying this is fantastic, everything's perfect, this is the future, but knowing the effort, money, time, complication of doing the other stuff, this could be promising as long as we find the ethical way to do it. So just kind of reflections and considerations about co-creation. You don't need that much technology to actually get the conversation going, right? To do the story. So it's the kind of getting people to go out and get stories. You can use technology to do that, right? And then creating that composite story that is entertainment education, that people can identify, can relate to, that is entertaining enough to be transporting, and that puts people in the situation to imagine what it would be like to make decisions. So the biggest resource there is really the training and the facilitators, and then the cost of producing the media, whatever that ends up being, right? The challenge is the time. You really, it's time. Like I said, you have to get the community to buy in. You have to get folks to want to participate. You have to be able to get them all in the same room or in the same Zoom, right? So it's time and it's challenge. And then that the outcome, that this is both good and bad, is very community specific. So perhaps that same story is not exactly scalable to everybody, but the method is. Why it's difficult? It takes time to develop trust. You can't just say, hey, community members, come talk to this university professor, because it feels like a focus group, which is not the idea, right? So it takes time, and that means, people have to understand that means money. That means getting the catering from the local place. That means spending some time and sharing, being willing to share about your life so that people will share about theirs, right? So it takes a genuine commitment by the right people. Not anybody can just do that. And then coordinating schedules and the needs of all, right? Because many times, nonprofit workers and academics like to work during the day, and that's not when families are available. But why is it important? It does result in better content. I mean, the evaluation that we have is not large scale, because nobody wants to pay for that either, right? But people like it better. They like it's compared to a PowerPoint, compared to a brochure, right? This really gets people engaged. It gets them asking more questions about what services are available. So going back to what works in prevention education, this has the identification, the relatable content, the language that is accessible. So it increases the likelihood for adoption and impact. It's inclusive. People see themselves, and people are actually part of the process, and they're getting paid for it fairly. And then, once you have that kind of group, it's a lasting partnership that you can work with to tackle other things, right? So yeah, so those are the examples that I wanted to share. This is my contact. So I would love to hear from you, and and if anybody has any comments, I would love to hear those too.